issues.
Put it on the paleo diet, that'll fix it.
Yeah.
There you go.
I think it might be that the Wi-Fi is
widely accepted in alternative circles, but it's completely ignored by traditional medicine. The gastroenterologist and integrative medicine practitioner, Dr. Robert Chutkin, says,
Tyson and
You got two things going on.
There's a commercial in the back.
okay. I'm going to do it without that. So he had this on a show about a month ago, and what he talked about was a woman that had twin boys, 4 years old. One of them had been on antibiotics for an ear infection, and the other one wasn't. They were playing soccer. One of the boys would cry. He would start to run and he would start to cry. They didn't know what was wrong, so they took him to a medical doctor. And they diagnosed him with having thorns in his joints. It turns out he had joint pain, and he developed juvenile rheumatoid arthritis, which is an autoimmune condition. The treatment for that is anti-inflammatories, which didn't help, so they put him on methotrexate, which is a chemotherapy agent, which is the treatment for rheumatoid arthritis. He wasn't getting better, so they took him to an alternative healthcare practitioner, and it took 6 weeks, and his symptoms completely resolved. So what the diagnosis was is that he had leaky gut. Has anybody heard of leaky gut?
Yeah.
A lot of you, because you're in healthcare. So it turns out that that's a really missing piece for a lot of people. What causes leaky gut and what effect does it have on you is really, really important. So let's talk about the causes. What we're talking about is that things that are in your digestive system are getting out into your blood that shouldn't be there. And what that can cause is, looks a lot like the list of symptoms that we had. It can cause fatigue and insomnia and headache and skin problems and that whole big long list, right? And what causes leaky gut? Surgery, antibiotics, a high sugar diet. Has anybody in here ever been on an antibiotic? Right? I mean, just like most of you, I was on them repeatedly as a kid. Are they great? Sure. Do they save lives? Yeah. Are they abused and overused? Absolutely. Does your body recover from the side effects of that? Rarely, without some specific intervention. And that's the important thing to notice. So I'm just going to ignore that.
Fine.
So mostly when people talk about being healthy, they talk about their diet. That's what's most important. I need to have the right diet. If I just have the right diet, then everything will be fine, right? Is it the Atkins diet or the paleo diet? Which one is going to make me healthy? And what we really miss is that it's not about the food you eat. It's about, do you digest it? Do you break it down? Do you absorb it? Or are there things that aren't broken down that are leaking out into your joints and your soft tissue causing problems? Oh yeah, that'd be great, thank you. And there's something else that's really important about this hierarchy of health. Thank you very much. You get sick in one direction, from top to bottom. You make poor food choices, you don't digest it well, you don't eliminate things well, you get constipation, diarrhea, gas, and bloating, which results in inflammation and immune problems. And there's headlines about inflammation, right? What is inflammation associated with now?
Everything.
Everything. Heart disease, cancer, diabetes, everything. Then your nerve system gets involved, which is your neurotransmitters, that's your brain chemistry. And then your hormones. If you've gotten down to the point where you have trouble thinking, you don't make decisions well, you have anxiety, you're not sleeping well, you have hormone issues, whether it's reproductive hormones, testosterone, estrogen, or adrenal, or thyroid, if you've gotten to that point, changing your diet is not going to make a dent for most people. It's necessary, but it's not sufficient to restore your health. So you get well going in the other direction. So addressing the hormones and the neurotransmitters is key. And the great thing is that so many people try diets and they don't work, right? How many people in here have tried a diet? to lose weight, to feel better for whatever reason. And it's really hard to stick to because it's inconvenient. You're giving up foods that you like, and you don't feel better. For most people, they don't get the payback. If you felt better, you would keep doing that. The reason so many people start and stop diets is because they don't feel better. So when I do this type of looking at people's health hierarchy, I tell them something will feel better in 2 weeks. Usually earlier, but always within 2 weeks. Anybody can do anything for 2 weeks. And after that point, you know, people are motivated to keep going. So if you have some of those issues that we talked about, like sleeplessness or headache or joint pain, it's not your age and it's not your kids. And it might not be your fault. It might be because you had a surgery or because you had an antibiotic and your body didn't bounce back. So how do you be healthy? Is it in your genes? We know a lot about genes, we know they're important, but they don't define your health. There are factors in your cells that determine whether that gene is expressed or not expressed. Are you healthy only if you're a vegetarian? Or maybe only if you're on the paleo diet? I can tell you, I see people on all of those diets that have health issues, and those diets don't make them healthy. Or maybe the only way that you can manage your condition and be healthy is to be on medication, right? Some people think that. Well, I have asthma, so in order to be healthy, then I need medication. If you go to my website, you can see a recommendation that I just got out of the blue from someone who swears I cured his asthma. I don't ever use the word cure, but, and he says that in his recommendation on LinkedIn. He says, she'll say that she didn't cure my asthma. I didn't. But he doesn't need his inhaler anymore. He was using the long-term inhaler and the short-acting inhaler every day.
Could I ask you a quick question?
Of course.
When you talked about in your genes, are they not a contributor? Would you not agree with that?
Let's put it this way. We know that there are risk factors for breast cancer, right? Genes being one of them.
Right.
There are 2 lifestyle factors that affect breast cancer. One is alcohol consumption, the other one is constipation. If you're moving your bowels less than once a day, it increases your risk for breast cancer 400%. So the conventional treatment that's offered to women that have the gene for breast cancer is radical mastectomy. I would say before doing that, let's look at some lifestyle factors and see if we can have your cells be healthy enough that that gene is not expressed.
Okay.
So you can have a gene for heart disease, for diabetes, but whether that gene is expressed depends on how healthy you are on a cellular level. Does that make sense?
Yeah.
And there's a lot that you can choose about that.
One slide ago, you said you recommended something for someone to do 2 weeks, and I didn't hear what you said what that was. It sounded like something really
Oh,
important.
no, that's what I tell everybody. Something will be better within 2 weeks, regardless of what the recommendation
Okay,
is.
thanks.
That's what I found, is that when I can do this really targeted approach, which is called functional medicine, and functional medicine looks at a systems approach. So instead of somebody coming in for headache and saying, well, what can you do for headache? I don't do anything for headache. I don't do anything for digestive problems. I don't do anything for psoriasis or metabolic syndrome or
It's a symptom, right?
right.
It's
I don't care what name is on it. I look at the whole system, and that's the functional medicine approach. And then we might end up with a treatment that doesn't even seem related to the symptom, but it is. So what is health? Health is the ability to adapt and compensate for stressors, large and small. So 3 steps that you can take now. So I don't want to just promote my practice and say you should all come to see me, and you should tell all your clients to come see me too. There are other people that do functional medicine, but I want to make sure that everybody knows that even people that are in healthcare run into problems that they don't know how to solve, or they explain it some other way. And there is an answer. There is another approach. So 3 simple things that I can give you to do. One is, what's the best diet? The absolutely best recommendation I found is Michael Pollan. How many people in here read Michael Pollan? Really? If you're in healthcare, please do yourself a favor. He's a journalist that writes about diet from a journalist perspective. He traces 3 meals from start to finish. One of them McDonald's, one of them an organic meal from Whole Foods, and one of them a foraged meal. You know, like grown locally from farmers that he knows, and you know, finding his own mushrooms, that type of thing. And it's really interesting, he actually buys a cow and a calf and watches it go through the process as far as he can. So his recommendations are really just common sense. He wrote a book called Food Rules, which I love that, right? It's like food rocks, rules. But it's also the rules of food. And it has very simple statements, like don't buy anything that has ingredients that a third grader can't pronounce.
Do it again.
Don't buy anything that contains an ingredient a third grader can't pronounce. As soon as you hear that, you kind of nod your head, right, that makes sense. The book is full of those. He has three basic rules for how to be healthy, how to have a good diet. Does anybody know them? Eat food.
That helps.
Right, and for me, the Safeway doesn't have a lot of food. Eat food, whole food. Not too much, mostly plants. It doesn't say don't eat animal protein, but eat mostly plants. It makes sense. So if you want more suggestions on diet, his book, Food Rules. Something that you can do starting today, chew your food. So the whole leaky gut little video clip from Dr. Oz, they link it to a number of conditions like psoriasis and headaches and all of the things that we talked about. But one of the ways that you can reduce that problem is by just making sure that your food gets broken down. So one of the ways I do that with supplements is using enzymes. But honestly, chewing your food makes a big difference. And then, so we want to work on from both ends of that hierarchy, right? We have to work from the top, and we also want to work from the bottom. Anything that you do that gets you into your rest and relaxation time actually literally takes the stress off of your nerve system and your adrenal hormone system.
Excuse me, what was that last sentence?
Your adrenal hormones, your stress response, anything you do that can get you into that relaxation mode actually literally takes the stress off your adrenal hormones.
Like meditation?
Meditation, visualization, yoga, sometimes just lying down and putting your feet up. As long as it's you're breathing, you're not thinking about work, you're not trying to manage 5 things at once, taking those breaks regularly can make, it's so simple. You know, when I was a chiropractor and I was dealing more with back pain and sprains and strains, I would tell people the most important thing you can do for this injury is ice. But when you have a lot of pain, it's like, that's too simple. That can't actually help me. Ice for this, but this is really painful. And this is one of those things nutritionally. It's like, relax, that's when I'm going to be healthy? Yeah. As unsexy as it sounds, it actually makes a difference. Okay, so functional medicine. So my 5-step program is the Restore Health System, where I go through these steps with people to find out the underlying cause. Thank you. And on a really basic level, what do you need to be healthy? 2 things.
Water,
What else?
nutrients and water.
What else do you need to be healthy?
Air.
Air. What else do you need to be healthy?
Rest.
So on a cellular level, there's 2 things.
Oxygen.
Oxygen, air, water, all of those things, that's nutrients in and waste
And,
out.
Waste out, yeah.
That's it. On a cellular level, you just need waste out and nutrients in. And if we can figure out which direction it needs to move, miracles happen, literally. But the key is getting the data. Don't just read a book or listen to the news and say, oh, yeah, vitamin D, I think I might be low in vitamin D, I should take that. Don't guess. So why does it work? Because it's a systems approach. It's not treating a symptom. It's not treating a condition. It's not treating your age. It's looking at the whole system. So I want to tell you about my $1 million success story.
You're bumping a bunch of buttons.
I do that, don't I? So I was seeing a woman in my practice who had pain in the female plumbing area. And she'd already had surgery and gone through what her OBGYN had recommended. And at this point, the treatment was, this is kind of graphic, I know, but you guys can handle it.
Yeah.
Well, then,
Close your ears.
Close your ears.
All right, so the recommendation from her doctor was plan on having a sex life that doesn't include intercourse. And don't pick up your grandkids. And this is how we'll manage it. That didn't work for her, so she kept looking. So she came in to see me, and again, it's one of those things, it's like, okay, there's an explanation there. We definitely had an explanation for her having pain and problems. But when you remove the stress on a cellular level, things get better. So I was able to help her, and she brought her husband in to see me several months later. And it took them probably 20 minutes of sitting there in my office, of kind of hemming and hawing, and they didn't really want to admit what they were afraid of. They were afraid he had Alzheimer's. They own $1 million business together, and a year previously, he had stepped away from the business because he wasn't thinking clearly. He didn't know what was wrong with him. He didn't say, I'm anxious or I'm depressed or I'm worried. He said, I just can't stand the thought of opening my briefcase. I have trouble making decisions. I don't really want to be away from my wife's side. You know, I guess this is just what it's like to get old. So I should just retire. So they left it to the wife, and they hired a manager who did a terrible job. So if you ask me, do I treat Alzheimer's? No, I don't treat any condition. I treat a person. So I did a systems approach, right? I looked at everything. I looked at his whole three-dimensional health picture. The result was literally once he started on a plan, it took 24 hours for him to feel better. Not 24 hours for him to be all better, but within 24 hours he knew he felt different. He had not worked for a year. He had hired somebody to replace him. I saw him yesterday. He said, I want to tell you I really for 10 more minutes, really appreciate what you've done for me. Because he just had a grandson a month ago, and he said, a year ago, I didn't want to be here anymore. So 3 weeks after he started his program, he was back at work. And now he wants to double the size of the business. So, lots more success cases I can share with you. I think I have like 1 minute left for questions, if there's a quick question. Yes?
What do you have to say about GMO food?
What do I have to say about GMO food?
What is it?
Genetically modified
It's not food.
Yeah,
It's
not
Franken food. They splice antibiotics and other food inside of food, mostly to increase its shelf life or to make it withstand lots of pesticide spray. So it's an experiment. It's a dangerous experiment. I think Monsanto is evil. Other than that, it's fine.
Tell us what you really think, Marina.
So, on a practical level, somebody comes into you and say, I don't know what's wrong with me. How much does it cost?
How much does it cost?
And then does insurance cover this thing? And I know it's going to be different for different whatever. And I'm just, how's that play
On
out?
a practical level.
I got a wife and I would have to justify it.
Right.
Kind of a thing.
I have 3 kind of levels depending on somebody's age, history, how much intervention they've had, how much testing we need to do. But roughly between 800 and several thousand. And it'll be between 2 months and 4 to 5 months program. And does insurance cover it? Some. I do request payment at the time because a lot of insurance doesn't, and your relationship with your insurance is with you. So then we just give you a bill to submit it to your insurance. There's one other question.
Colonics. How do colonics fit into this total health picture?
How do colonics fit in? I'm neutral on them. I'd say, depending on the person, they might be helpful, but they aren't always, especially if you do serious of it.
Do you run into pollutants in the body?
Do I run into pollutants?
Yeah, I mean, in terms of discovering that in your work.
Um,
In terms of people having, stuff in their fat and so forth.
You mean toxins?
Toxins and so forth.
oh yeah,
Yeah.
absolutely. Yeah, I mean that's part of why people end up with joint pain and autoimmune conditions is because their immune system is trying to handle those things. So how do we do it in a way that makes it easiest for the body is the key. Yeah.
I'm
Last
concerned
question.
about the antibiotics that are in milk and meat and things that we have no control
Yeah,
over.
I am too.
So